According to a new United Nations report, an estimated 5 million children died before their 5th birthday, and another 2 million children and youth between 5 and 24 lost their lives in 2021, according to the latest data released by the UN Interagency Group for Child Mortality Estimation. In a separate report also released Monday, the group found that nearly 2 million babies were stillborn during the same period. Tragically, many of these deaths could have been prevented with equitable access and high-quality maternal, newborn, adolescent, and child health care. Children born in sub-Saharan Africa are subject to the highest risk of childhood death in the world, 15 times higher than the risk for children in Europe and Northern America. The World Health Organization says that less than 1% of vaccines used in Africa are manufactured on the continent. The continent, along with many developing nations, depend on developed nations to obtain life-saving vaccines. The African Union aims for the region to develop, produce, and supply more than 60% of the vaccine doses required on the continent by 2040. It's an ambitious target that observers say requires bold investment, the need for highly trained, skilled labor, intense quality assurance and control, and political will. For more perspective, I spoke with Dr. Ebere Okereke, technical advisor at the Tony Blair Institute for Global Change.
In Africa, we have always had a challenge with vaccine-preventable diseases that our health systems haven't been good enough to ensure that everybody who is eligible for vaccination gets those. So we have had annual outbreaks of cholera, for example, in the seasons, and our uptake of our coverage for measles has never quite reached that threshold where we interrupt and prevent outbreaks. However, in the last 2 years, as a consequence of the response to the COVID-19 pandemic and the pressure that's put on the very fragile health systems we've had, routine immunizations for children, such as measles vaccinations, have dropped. And it just goes to show how important it is that we maintain health systems that are resilient and able to deal with the pressures of an outbreak while maintaining routine services such as childhood immunization.
How does Africa fare in terms of access to those vaccines?
Our health system's capacity to deliver vaccines routinely is not optimal. We have underinvestment in our health systems, and we are often reliant on donors to fund essential public health programs, including childhood immunization. Secondly, is the fact that we don't actually manufacture a significant amount of the pharmaceutical products that we need. It's predominantly because we haven't invested in the system. We haven't created an environment that is attractive for manufacturing to occur on the continent. There has been a lack of political will and financial investment in the ecosystem. We know we have a population of 1.4 billion on the continent, so there's a potential market, but we haven't actually created the demand. There are vaccines that are actually licensed and exist at the moment, which we don't currently use across the continent in our routine immunizations. Take, for example, hepatitis B vaccines. Those vaccines exist, but we're not using them. So it's a complex issue. And then, of course, the final challenge is actually getting vaccines from the port into people's arms.
How do we make sure that Africa is prepared for the next crisis?
So we need to have the global ecosystem recognize the challenges, and that the challenges experienced by Africa are global challenges. We have to grow our own research and development capacity. Currently, our governments collectively on the continent invest less than 1% in research into pharmaceutical products, 1% of their GDPs. We need to create an enabling environment for international companies to partner with African manufacturers to manufacture here. To do that, we need to understand the size of the market. We need to make sure that there's funding available. We need to ensure that the manufacturing sits alongside the research and development and the people, the talent, the workforce that need to work in those industries. And then we also need to create the demand. National countries have to identify what the burdens are in their countries, set strategies to ensure that vaccines that get to their shores can be delivered to the people who need them. And to do that collectively, we as citizens of the continent, and the 55 countries that are part of the African Union, need to hold our governments to account. We need to actually remind them that health is not a drain on resources. Health is an investment.
Dr. Ebere, what is the best case scenario in terms of vaccine manufacturing on the continent? Is it a manufacturing plant in each region, in each country? What are we talking about?
What we need is manufacturing that's tailored to the continental needs, that creates enough capacity to serve our needs and provide some resilience and wiggle room. So what we've done through the Partnership of Africa Vaccine Manufacturing is to develop a continental strategy, which identifies which vaccines we want to see manufactured on the continent, what sort of technology we should like to see, aiming for a spread, a diversity of technology so that we have resilience in the system, and also looking at different parts along the value chain, whether we're starting from the research and development all the way to just the fill and finish and packaging. We need to ensure that we have enough diversity to provide that resilience, but not so much that it becomes financially unviable.
You are the technical advisor at the Tony Blair Institute for Global Change. When we talk about global change, what do we talk about?
It's about equity. It's about creating a world where the resources that are available are equitably accessible to everybody. So what the Tony Blair Institute does, not just in the health space, is work with governments to improve their ability to deliver to their citizens, to improve their economy, their development, their health, so that they have more equitable access to the global pie.